Assalamu alaikum. Good afternoon, everybody. Welcome to this afternoon's webinar. It's a great pleasure to welcome you all to join part 4 of this webinar series. I'm Zakaria Nazar. I'm the CPD coordinator here at Qatar University Health. And for those of you who haven't been attending, or for those of you who are just joining this fourth part of this webinar series, I just want to say a big thank you to everybody for the feedback that you provided, and continue to post your questions on the chat throughout the webinar. We try our best to get through as many questions as we can. For those questions that we weren't able to answer in the previous weeks, we will attempt to put them to the speakers during today's webinar. Before we start, just a few housekeeping. So today's webinar is part 4 of this 5-part webinar series, and today we're focusing on creating a multidisciplinary system of care. So as I mentioned, this is the 4th part of this 5-part series. Next week will be the final part, where we will be introducing patient and family experience, which we'll also be touching on during today's webinar. Each week, the webinar is scheduled from 12 till 1 p.m. on a Wednesday afternoon. So I just want to say a big thank you to Renad Academy for their collaboration in today's webinar. The speakers will all be coming from Renad Academy, and we're very thankful for them giving up their time and sharing their insights on their topic. Before we start today's presentation, I'd like to declare that the presenting authors and the Scientific Planning Committee have no relationships or no conflict of interest to disclose. And the learning outcomes for today's webinar: we want to describe the roles of healthcare providers in providing care for children with autism, to direct patients and family members to available and appropriate organizations and services here in Qatar, discuss opportunities for continuity of care beyond hospital settings and creation of a multidisciplinary care system in Qatar, and finally, to describe strategies of providing information about ASD to individuals with autism and/or their family members. So, in terms of collecting your CPD points, I've emailed all of the registrants with the URL link for today's survey. This will become active at 1 p.m. today. So at 1 p.m. today, you can complete the survey, and we'll be sending your attendance records to DHP to update your CPD points. This link will remain active for 1 hour. So please continue to complete the survey as soon as the end of the webinar happens. Regarding your questions, please use the chat to post your questions. Avoid posting anything other than your questions or comments in the chat. It's nice to say good morning and hello, but we don't want to have too much traffic in the chat, just so we can try to isolate your questions and put those to the speakers. And when you're typing your questions, try to be as clear and as succinct as possible, so it makes it easier for us to interpret what you mean by your questions, and we can put them to the speakers. I'd also like to take this opportunity to thank Dr. Shahad El Amin. She'll be moderating today's session and putting your questions to the speakers. And so without further ado, I'd like to introduce Dr. Shahad.
Thank you so much, Dr. Zakaria, for this introduction. Today's CPD session is not really your typical CPD activity, I guess. We talk a lot about the collaboration between healthcare providers within the healthcare system, and sometimes we tend to forget that our role goes beyond what we deem as the healthcare system, and we also have a responsibility to collaborate with other sectors beyond healthcare. This is why today we're really happy to have speakers from a setting where such a crossover exists between healthcare and education. Today's panelists are from Renad Academy. Renad Academy was established by Qatar Foundation for Students with Autism in 2016 to support children and families impacted by autism spectrum disorder. In Renad Academy, highly trained teachers work alongside autism specialists, speech language pathologists, occupational therapists, and school pathologists, psychologists to provide state-of-the-art instruction to students. The Academy's vision is that it provides education and specialized services to students, training and support to parents, and establishes a center of best practices for people with ASD in the community using evidence-based practices. As always, Our team will be monitoring the chat for any of your burning questions regarding today's topics and learning objectives. So without further ado, please welcome Ms. Hiba Siraj, Ms. Rula Satouf, and Ms. Zina Nakuzi. So you may share your slides right now, inshallah, and we can start.
Okay, hi, good afternoon, everyone. We are so delighted to welcome you to today's webinar. Thank you, Shahid. Thank you, Dr. Zakaria, for the introduction. It's truly inspiring to see like so many participants from various parts of the world all gathered to deepen our understanding and enhance like our collective efforts in supporting individuals with autism, for sure. So, as mentioned in this webinar, we will explore advancements in autism care beyond traditional settings, focusing for sure on Qatar's integrated care systems and educational initiatives. And we will also describe like the roles of other care providers for children with autism. We'll also discuss strategies and suggestions for delivering accurate information and addressing the challenges for sure in creating a stigma-free environment for individuals with autism spectrum disorder. So as mentioned, our discussion aims to offer insights and solutions that respect cultural and linguistic diversity, promoting a globally inclusive approach.
So, hello everyone. Before we start, as Dr. Zakaria has mentioned before, we would like to affirm that as presenters involved in this webinar, we have no financial relationships or conflict of interest to disclose. And this ensures that the content provided in this webinar is unbiased and solely focused on the knowledge and understanding in the field of autism without any external influence. So we are committed to maintaining the highest standards of integrity and transparency throughout all this session.
Okay, so I'm Hiba Siraj. I'm a board certified behavior analyst and I hold a master's degree in special education from Qatar University. I work for an autism school as a department lead and have truly developed the passion and knowledge and expertise in teaching children with autism over those years. So thank you, and thank you for everyone who's attending. And inshallah, we'll have a good content for you, inshallah. Okay, Rola.
Thank you, Hiba. So again, my name is Rula Satouf. I'm also a board certified behavior analyst. I've been in this field for like 10 years, working with children with autism, their parents, and the community. And I hold masters in special education. And, you know, I believe always that empowering parents and maintaining their engagement throughout their child's learning, in addition to spreading awareness in the community, this for sure will help children with autism to reach their fullest potentials. Zaina?
Hello everyone, I'm Zaina. I'm also a board certified behavior analyst and I hold a master's degree also from Qatar University. And I work in Rinad Academy as autism specialist this year, responsible from the outreach programs and community-based instructions. Thank you so much for joining us and we hope you really enjoy, and as Hiba said, to have a good content for you that you can use in your practice.
So first here we're gonna start when talking about autism. We want in examining the global context, we can see easily that the prevalence of autism is really increasing a lot recently, and it varies from a place to another. When you see or check the accurate data or statistics. So internationally, studies indicate varying rates, with approximately 1 in 160 children on the spectrum, according to the World Health Organization. When we shift the focus to Qatar, there's like a recent study which was like published in 2019 by Qatar Biomedical Research Institute of Hamad bin Khalifa University. They have provided us with updated local data. The study reveals, as we can see here, that like ASD in Qatar affects 1 in each 87 children. And like this study was made only for children, not for adults. So specifically, like the data says that 1 in 56 boys and 1 in 230 girls. So we can see the difference, like it's like approximately 4 to 1, the ratio between like the boys and girls, like having more boys diagnosed than girls. So we can say that like the research here, there is not so many research that have been done in that field. And of course, ongoing research are definitely needed to accurately determine the number of impacted children and young people. So such data is crucial. We always say that for like informing educational planning and ensuring that a comprehensive range of like provisions and services are developed to meet diverse educational, health, and support needs. So we always say that we need this data not only just to know the number, we need to make sure that there is like enough services like by the, the health care and education that are provided to those people.
Thank you, Rola. And you know that we can really proudly say that Qatar has moved forward so rapidly in the area of autism. So there is a huge commitment among the leadership that is something that should be recognized and talked about, with strong efforts being made to make sure that parents are not stigmatized. So it was initially Her Highness Sheikh Hamoza bint Nasser who proposed April 2nd as World Autism Day to the United Nations in 2007. So previously, Dr. Bernard, who was an autism researcher, he had the idea to recognize a month for autism, and that was in 1970. And in April 1988, President Ronald made it official, like to have that April as Autism Month. But Her Highness Sheikh Hamoza bint Nasser, she proposed April 2nd as World Autism Day to the UN in 2007. So this strong and active support from the ruling family for disability rights was seen as one of the key reasons to why Qatar has moved forward so quickly in that area. So many parents and organizations really valued this support and were positive about the way in which stakeholders, including families and parents, they have been involved from the outset.
Okay, so if we want to start by discussing our opportunities for continuity of care beyond hospitals, we can surely say that effective continuity of care for individuals with ASD often involves a network of services that go beyond a hospital setting for sure, integrating educational, healthcare, and community services. And these services, they all work together to provide a continuum of care that supports individuals throughout their different stages of life. So there is a need to move from an exclusively medical model to involve an educational model too. And we have personally experienced how education and skill-based treatment can so much and very positively benefit students. So that's, so it's very important to incorporate both the medical and the educational model. And of course, as we always say, the younger we start, the better.
Early intervention.
Okay, so now we're starting talking about the rules here. We can say that, as Hiba mentioned, that schools and centers play an important role in the ongoing care for students and children with autism. So offering a range of specialized support like services by those like places, the schools and centers, these services are providing through a multidisciplinary team, as mentioned, of teachers, like therapists, parents for sure, they work all together. So as we can see, like on the slide here, we can see that like there's like the medical support, there's the educational support services, and there's the speech language therapy, occupational therapy, behavior therapy, psychology services, and we're going to talk about the community like based learning, inclusion programs, and vocational training programs. So, Zaina, if you can start like with the first one, when talking about the pediatrician, we know that this is like about the healthcare, but we can say that the pediatricians who start and continue providing care for children with autism, they continue always the journey with them. So they serve as the central figure, we can say, in the healthcare management of the child, overseeing physical health, growth, and development, for sure referring the child to the like specific like therapy. So they coordinate with other specialists to ensure that all aspects of the child's health are addressed, including like routine screenings and vaccinations. Also, we can say that they play an important role on managing any comorbid conditions, like, for example, when we say sleep disturbances or GI issues that are common in children with autism. So moving to the next role, we have next slide.
So can you see it?
Yeah.
Yes, psychiatrist.
Yes, please, Roland.
So after, yeah, Hiba, you are like talking about the psychiatrist here.
Zaina is.
Yeah. Sorry. So here we can say that also a child psychiatrist have like play a major role in assisting families and individuals with autism, especially as Rola said, when we have comorbid conditions. So sometimes we need to administer some medications, sometimes we need to look for like some seizures. And I want to say that it's good that sometimes we have informations from them. We have information for like the medication like individuals are taking. But in Qatar and in other places in the world, we don't see like such, let's say, collaboration, a deep collaboration between both of them. Because when we administer medication or we take some medications, we need to look objectively on that medication effect on those individuals. So especially like with students, with individuals with autism. So it's not enough to just like, subjectively determine like the amount of medication. It's very important to deal with behavior analysts or school psychologists to follow up with the parents and the families and the teachers in the school if this is really enough, if this is really important, if this is really effective, like for the child, for the individual. So psychiatrists definitely plays like a vital role in the multidisciplinary team, and ongoing follow-up and ongoing collaboration is crucial within the team.
Yeah, that's really like right. And like, for example, when we say that we have lots of like children who had like medicine and they're like, so okay, we go to the psychiatrist and they like prescribe a medicine for them, but we need to follow up on like their behaviors or their attention. How does this like medicine is affecting them? So as you've said, by collaborating with a psychiatrist, for sure we can see how successful or how the dose is like really fitting that person or not.
Yes, exactly. Thank you, Rola.
Okay, so moving to psychologists who play also a very, very vital role here. So what are their roles? So they mainly offer diagnostic assessments and ongoing psychological support. They usually conduct those standardized tests to confirm autism diagnosis and assess IQ and other adaptive behaviors, such as daily living skills, functional skills, social skills, and communication skills, and etc. And psychologists also provide therapy sessions to help the child manage emotions and develop their social skills through various techniques that are tailored to each child. And of course, like in a school setting, we have a school psychologist, and in a clinical setting, there's also like a clinical psychologist.
You know, like when we speak about like the roles, we can see that everyone has a significant role here, like, you know, psychologists for sure. And now when we say speech language pathologists, SLPs are really very important to have like in the journey of like the child with children with the autism. Like, you know, like one of the key aspects for like autism is like a deficit in communication. So having a speech pathologist is essential for enhancing communication skills. They assess and they treat speech, language, and communication issues, and they work on articulation, fluency, voice volume control, as well as nonverbal communication skills, such as understanding gestures and facial expressions. And we always say that once like the language and communication of the child with autism increase, we can see that the challenges and like the, you know, the challenges that they have and the behaviors that may have, it will reduce definitely, because it can be, or if it's not all of it, it's like due to lack of communication.
Exactly. Also, we have our OTs, our occupational therapists, and as Rola said, I want to say like OTs plays a vital role, and as Rola said, like everyone in that multidisciplinary team plays a huge role in developing skills needed for the individual to strive in the community. So occupational therapists, as I said, they are known as OTs. They play a very important role in helping individuals with autism develop the skills they need for their daily life. They focus on particular life skills like dressing, eating, personal hygiene, as well on improving motor skills, which include coordination and balance. So these skills are crucial because they help individuals manage everyday tasks independently. And another important area for OTs is sensor integration. We know that many people with autism experience challenges with how they process sensory information. So occupational therapists provide therapies designed to help them handle these sensitivities better. So this can make a big difference in how they react to the environment and interact with others. So also OT advise on making environmental modifications at home or school to better accommodate individuals with autism. And these changes make these spaces more supportive and accessible for individuals with autism. They also assist with educational and work-related skills, preparing individuals for school and employment. So this includes, let's say, teaching time management, following routines, and even specific job-related skills. Lastly, we can say that occupational therapists provide tremendous support to families and caregivers. They can equip them with strategies and tools to support them significantly improve their quality of life.
Okay, so moving to special education teachers, and hats off to special education teachers. So they do a lot of things. They develop and implement educational programs tailored to each child's specific learning needs. They use specialized teaching techniques and methods and materials to accommodate the child's learning styles and help them integrate, and they help the children integrate in a very inclusive learning environment. They also advocate for their learners so that they ensure they have access to appropriate services and accommodations, and they adapt the curriculum and the teaching strategies to accommodate those learning styles, and they're very, very different. And they also collaborate with parents to ensure that parents are on the same page and they're following the same techniques at home and the same behavior plans. And one very important thing is that they always have to keep very updated about the new research, because in special education things are always changing, and so they always have to be very active participants in those professional development opportunities, and they have to be like very updated with the research available, and so they have lots of things to do.
Okay, now when we talk about like behavior therapists, like typically they are trained in ABA, which is the applied behavior analysis. They focus on reducing like challenging behaviors, we can say, instead of problematic like behaviors, and teaching new skills, improving functional communication and social interaction. And behavioral therapists set up structured, goal-oriented programs that are crucial for the child's behavioral management and development. And we can see here in Qatar that there is like lots of centers that they say that we are following the ABA approach, which is the applied behavior analysis. We have to make sure that like the people or the therapists that are working with our children are really like certified and qualified, because there is like lots of misconception, to be honest, that has been raised like recently about like ABA. So here we can say that when you are working with any of these like people, just make sure that they are really qualified, that they are really certified, just to run like the programs or whatever they're doing in the way that it's supposed to be, like with fidelity, we say. Okay, so if we move to the next one regarding the dietitian and nutritionist, like here, like what they do, they evaluate the child's dietary needs and formulates nutritional plans that can address like specific issues, such as food intolerances, which may affect the child's like behavioral and physical health for sure. And we can see that some children, they are rigid, they like only one kind of food, and like parents always complain that, oh, I want him to vary the things that he's eating. So here we tell them that they can like go, or they can be referred to a dietitian or a nutritionist. And also they provide guidance on maintaining a balanced diet that supports overall health and developmental needs. So we can see here that by working collaboratively, like regarding all the roles that we've just mentioned, these professionals in collaboration for sure with parents, because we always say parents, they have to be included in this like multidisciplinary team. So we are all together ensure that the child with autism receive a holistic care that addresses all dimensions of like their health and development, and eventually like optimizing their potential for growth and integration in the society.
Here we see community-based programs. It's not one person here, it's not one profession. It's actually the community who's working together to ensure that the child is receiving the best care possible. So when I say community-based services, we can extend the multidisciplinary team to the community. So those community-based programs really teach valuable life skills such as shopping, handling money, interacting with others, and interacting with others, and integrating these experiences into individuals' daily routine. For example, at our school, we take students to supermarket trips to practice these skills in real-world settings. And I can't stress enough about the impact it was done for the students and the community. When we started, we could see that very few interaction between staff and student, or we could see like the pity look, which like did not disappear at all. But now at least staff started like seeing some strengths in our students, and they started more interacting with them. In addition, we have like vocational training programs, which are really very important. For instance, our middle school students have begun a vocational training program in collaboration with the QCDC, which is the Qatar Career Development Center. And this initiative introduces individuals with autism to various workplace environments. So this prepares them for future employment and educate them with the expectations and tasks of the workplace. So this exposure is designed to ease the transition from the school to workplace and equip students with the necessary skills and experiences to thrive. All of these comprehensive approaches underscore the importance of a holistic care. As Rola said, it's a holistic care model that extends beyond medical treatments, including educational support, practical life skills, vocational training. They all support the overall growth and the social integration for students with autism.
Okay, so just commenting on what Zaina has said regarding the community-based instruction, because we are also involved in this program. It's very hard work in the beginning, but really it pays off when you see how even the you know, like the cashiers, the you know, like the people that are helping there, how they were, you know, like how they used to look at us in the beginning, and how now they can get sometimes, you know, like just, you know, like when we're coming, they just can, you know, like stay out of the way for our students to go, and they just with a very big smile on their faces. And of course, you know, like and it's very noteworthy to say that how the children have gone from with very, very basic skills, you know, like they just, you know, like very basic skills, even with just, you know, like with all the physical prompting, and just taking them from an aisle to an aisle and just finding where their things are. And now they just go, they get their trolleys, they just go and navigate through the aisles, get what they want, go to the cashier, you know, all in a different level. But we can see huge progress in things like that, especially involving the community. Okay, so moving on to our next topic that covers strategies of providing information about autism for individuals and families. So in Qatar, the approach to autism spectrum disorder diagnosis and management has seen really significant advancement, and we can see this. But still, there are still some challenges, particularly regarding public understanding and the accessibility of the diagnostic services. So, and therefore families often seek diagnosis abroad due to the inconsistent local services, and the emotional toll on parents is also very, very considerable. So understanding autism and navigating those related challenges can be very overwhelming. But with the right strategies, families and individuals can receive the support they really need. And it's very, very much growing here in Qatar. And, you know, like on the slide, we can see some quotes from professionals and parents from the WISE report, like something like, pediatricians are scared to tell the parents. The mom was very defensive and said, no, my child is just a little bit delayed. So the parents are preventing them or preventing their children from getting services because they are so scared, or they don't want the stigma. Something like, I want a TV commercial that shows me the red flags. Like if your kid is not developing pointing, then this is a red flag. Like the parents wants us to say that the child is perfectly fine. And when we do an assessment, a lot of parents fight against it. And last, we have met people who are very much in denial and they don't want to admit it. So, you know, like, but it's all, you know, like it comes from a very empathetic point of view. Because we know very well that the parents, they, you know, like they go through a grief cycle, and acceptance is not easy. They, you know, like it just goes from the shock and the denial and all this, but at last they do accept. And when this stage comes, really things change. And now Rola is going to go through those strategies aimed at effectively providing information about autism to individuals and families.
Yeah, for sure. We always hope that these strategies and suggestions are implemented here in Qatar and everywhere. So after receiving an ASD diagnosis, it's important that healthcare providers, we always say that they offer comprehensive diagnostic feedback sessions, as there are parents who have no idea on what autism is or what it encounters, So it's very important that these sessions, they explain the symptoms, the expected challenges, and discussing available therapists and support systems. Of course, it will help the parents a lot. So also, other thing, as what Hiba has mentioned, that addressing the emotional concerns of families also is very important, as lots of parents, they feel overwhelmed with the diagnosis. We always say that they go through the grief cycle, what we've just mentioned, that they may go through shock, denial, until they reach the acceptance. And we always say that these emotions are okay, but the parents, they need to know that these emotions are okay by talking to them, by identifying these emotions and telling them that it's fine until they reach the acceptance level. So here, after telling them that this is okay, how? By providing like for sure clear and empathetic explanation that can significantly help with the fears associated with the diagnosis and the uncertainties that lie ahead for those parents. And like moving forward, we can say onto the community education. We always say that regular workshops and seminars are essentials also for educating families and individuals about ASD. So these events for sure should encompass a wide range of topics, including like daily management techniques, advancements in treatment, and can be also practical advice for handling common challenges. And we always say that like parents, they need to know about like autism to increase their knowledge about it. And what they also need is like tools on how to deal with such like challenges. So making these workshops accessible to everyone in the community in Qatar is particularly important, as it helps support families who may feel like isolated or prefer to seek like information from their home. Sometimes, like sometimes we go for a home visit because we feel that those parents, they need to discuss the challenges that they have, like, specifically and individually. And we always have to look on the individual needs of the parents and support them. And like then when we talk about like the digital resources, like the development of a multilingual online platform can provide extensive resources about ASD. So make it accessible to Qatar's diverse population for sure, having it in Arabic for the first language, English, and other like languages, it can help as well. So this platform could include instructional videos, detailed articles, and interactive webinars. Additionally, online forums, they all can like serve as a community space where families can share experiences and offer a mutual support. Sometimes we find parents that all what they need to share their experiences with other parents. So when they meet together in the community or in certain workshops and everyone share his own experience, this means a lot to them, that like other people, they are sharing the same challenges with them. So this gives them the motivation to carry on and move ahead. Also, incorporating ASD awareness into school curriculum is very important. That can educate young students about the spectrum, promoting understanding and inclusivity from an early age. And we always say that educating siblings is very important because they can help at home, like they can help their parents, they can help their siblings with going through this journey. So educating siblings and the students in the school, this is also a good thing for that help peers of students with ASD learn how to interact supportively, fostering a nurturing environment within schools and helping to reduce the stigma associated with the disorder.
I just want to add something here, Rula, because we spoke about like how much parents they need that emotional support, and who's better than giving that emotional support than other parents who are going through the same problems, they are same issues, same difficulties. So in Qatar, there is a group of parents. They have launched I think 2 years ago, not more than that, a group of parents. They call themselves the Blue Circle, and they are all parents for children with autism, and they are meeting regularly. They are supporting each others. They are doing also workshops. They are supporting each other's emotionally. They are giving some training to the siblings, and they are playing a very important role in raising awareness in Qatar. So this is one initiative that's really hats off in Qatar for those parents. And if I want to speak about the media, where we are all getting our resources now online, Facebook, Instagram. So we should really highlight the importance of media and the public awareness campaigns that can effectively educate the broader public about autism. So we can use those platforms to celebrate the successes of those with autism and give important tips on how to help families and individuals who have autism. And in addition to that, because we know like we're an Arab country and how much like the important like the culture and the religion here. So having well-known people and religious leaders support our message can really help change how people see autism and reduce the negativity around it. So by putting those ideas into action, Qatar can make its support system for autism better, giving families and individuals the tools they need to handle the disorder well. So this complete approach can really improve the life for those with autism and help build a community that's more welcoming and supportive, if you can say. So if we can see here, like in that slide, also from the WISE report, some of the parents and professionals they have raised like lots of, like concerns. Like, I have not told my family because if I told them, they will give me like the pity look. Or other families have said that, especially like here in the Arab culture, this is a disorder that affects our boys. And we know that like how important are the boys here in Qatar. So for them, like having a boy with autism is like, will give them like, they will be ashamed to admit that they have a child with autism, especially a boy with autism. And also if we will just like discuss the language here. So autism in Arabic means tawahhud. So tawahhud means that I want to stay alone. And if we just go through like the signs of autism, yes, they have some communication problems that sometimes hinder their social abilities. So it's not because they like to stay alone, no, because lots of their challenging behaviors, their function is attention. They like to stay around people, but they don't know how to communicate with other people. They don't know how to really make friends and like be socially included because of that like barrier, which is a huge barrier for them as autistic people. There is such a big pressure for a child to be normal as well, if you will consider that also, like this is a point that was raised from parents. And we can see here that some of the people will say that my child goes to a normal school, or in the contrast, which is an abnormal school, which is like their child is not normal. So we want to really focus on here that it's different, not less. We're all normal here. It's just like autism is like, he sees the word, he's learned in a different way. He's not less, he's just a normal person who learns differently. And
so here,
our
like
culture,
Zaina, we stress, sorry Zaina, but we stress on
yes,
the importance of like enhancing the awareness about like autism. When it's like everyone knows what is autism, what is like, is it about? So we can like, as you said, amend these like terminologies that we are using, or the language or the negative language that we are using about autism.
yes, thank you, Roland. Thank you, Roland. So as we said before, that our culture wouldn't like to have the child different from the other. So this is just like it's our culture. We're really making progress, but there's still a long way to go.
Zana, I really like what you're saying about stigma and how it's affecting the community here in Qatar. And really, this is related to many of the questions that we've been receiving throughout the different sessions since we started this series. Since there is a lot of stigma, I mean, it's way better compared to before, but still, since it still exists, how can you really maybe advise healthcare providers to go about explaining what autism is to their patients or someone that they know from their family? Perhaps can you give us an example of how to approach it?
Yeah, thank you, Shahad. So as we said, that one of the main things is awareness, and awareness starts from the diagnosis to the education. So we're all responsible, like healthcare providers are the first ones who will address that diagnosis, and they will be the first one who will respond to the questions raised by the parents, and they will have to answer all their concerns. So what we say is that we should really give those parents, like after the diagnosis, lots of sessions, lots of support to understand and remove those misconceptions, because there is still until now misconceptions about like the causes of autism. So lots of the people think that this is still until now that they think that this is due to a vaccine, like MRI vaccine, so which is not the case. So from there, like the healthcare provider should like we until now also we don't know the exact cause, so this should be clear also for the parents, and tell them like what are like the different what are like the signs of autism, like how do they learn, like what are the things that like their strengths, not only their weaknesses, so from the beginning.
Yeah, and can I add something?
Yes, please. Okay, so I'm just going to add that, as Zaina just said, like focus on the strength. We've been dealing with lots of children with autism, and oh my goodness, they can do really. There are so many wonderful things in these children. There are so many strengths, and so we should focus on, and we should tell the parents to focus on these strengths, and always use a positive language with the parents. We can ask them the things that they can do rather than what they can't do. We want the parents to even like shift their focus on the strengths of the children. And just one more thing, like like there have been theories which have proven completely wrong, such as refrigerator mom, such as very the parents who have very high IQs, that so like theories like this, they tend to make parents like feel the guilt, and which is totally not true. And it's very sad till now that we can hear people who say things like that. So and it's like the research has all like they have completely like deleted such theories. So it's very important how we tell parents and how to get the guilt out of parents.
Yeah, and also Shahid, another thing I want to add to what Hiba and Zaina have said, like regarding like the terminologies again, like for example, when we speak in Arabic, we say al-musabuna bit-tawahhud. Like we always try, like, and lots of organizations like they use this terminology. We always, which is in English, we can say people who are affected by autism. So we always try to avoid using this terminology, because using positive language involves describing individuals with ASD based on their like abilities and strengths rather than their like limitations. It makes like a big difference. So there's a big negative impact of inappropriate terminology on families and individuals with autism. Therefore, like the efforts to promote positive language that respects and acknowledge the dignity of individuals with ASD is very important. Like, therefore, in education and public like discourse, we always shift from the terms like disease to like neurodiversity to disorder,
Yeah. Yes, and even in English, we hear a lot people saying suffering from autism.
Exactly.
Yes.
Yes.
Yeah, and also like that stigma around autism and lack of awareness and understanding about autism delays usually the diagnosis, and we know how important it is to start like for an early intervention. So all of those things will really delay the diagnosis and the services and going on like to the other things. So yeah, and lack of appropriate support.
Well, we've received a question that we received last week as well. So this is from local practitioners. So you've mentioned the stigma, and sometimes the stigma extends to parents who they have some sort of denial of the symptoms or the signs that a child may be exhibiting. So as a healthcare professional, if, say, for example, this question today has come through from a dentist, a child visiting a dental practice for a routine appointment, if the dentist themselves recognize this and they are met with some resistance from the parents, are there any sort of mechanisms here in Qatar where healthcare professionals can maybe report or flag or just to report their concern? Is there any sort of mechanism for that here locally?
To be honest, not really. One of the things that they can do is that they can just like ask many questions. Maybe this will just raise a red flag for the parents, and this will, you know, like by raising those questions by the healthcare professionals, like one after the other, this will maybe solicit parents to go and really ask for like other things. And he cannot prove it. He can just like maybe, yeah, he can just like, you know, this will help him to, you know, help parents to just maybe see it in a different way, maybe, because definitely they would have like heard it from different people, but hearing it from a professional might raise that red flag, and maybe they will go ask about like to furthermore, like, you know, furthermore about this issue.
Any advice that you would have for such healthcare providers on like where to direct such patients to get specialized assessments, maybe just like consultation with...
Yeah, Shahid, I just want to highlight something here, that we always say that autism specifically, there has to be always collaboration between healthcare and education, because we cannot separate them. There always has to be a kind like of connection, a kind of collaboration, because if even those parents, they went to the dentist and they would not tell him that, oh, I'm denying, you're not right. Sometimes to figure out the emotion or the grief like level that the parents are in is not that easy, you know. Sometimes like through our workshops, when we start like talking to them, we can see like at the beginning they're like refusing to participate at all in the first session. They don't share any kind of experience, but like the second, the third session, you can see another like people, like they start to feel more comfortable, like facing other parents, talking more about themselves. So we can like here stress again on the importance of having like workshops and trainings that the dentist and the other healthcare are familiar of, you know, that they have to make sure that, oh, there is like this kind of a training that, for example, Renat Academy, they are like offering for parents. When they refer parents to those trainings or workshops or any other place, then we can have together in collaboration with the healthcare to just like, you know, like empower the parents and help them get rid of that kind of emotion until they reach the acceptance. It's not like, you know, a one button that we press and that's it. It's like related all to the suggestions that we had in our webinar, that there has to be regular workshops, regular trainings, collaboration between those, like, you know, the teams, the healthcare and the education.
Perhaps this is a good chance to ask, can you talk a bit about the trainings that you have, or maybe about trainings, opportunities for training and resources here in Qatar in general?
Yeah, like that is one of the training that it's spread all over Qatar. It's not only in Renat Academy, it's also in the Hamad Corporation. It's called the Early Bird Training. We've been like trained lots of people in Qatar, and they are certified on running this training. And we always say that this is really a good one, because it like you know, we just target here the children, the parents who have children who are like recently diagnosed. So as we've said at the beginning, that parents at the beginning, they feel overwhelmed. They don't know what is autism about. So referring them to this training through like Romela, and there is also Sidra and us as well, to this training, and having these like this training, like it consists of like 8 sessions. It will increase like awareness and knowledge about autism, and it will help a lot. You know, this is one of the trainings that it's not only in one place, it's in more than one organization between the healthcare and the education places.
Thank you so much. And perhaps since you do this training at your setting as well, can you speak a bit about any cultural sensitivities that are very specific to Qatar that we have to keep in mind while communicating about autism to patients or parents?
Hiba, do you want to add?
Okay, so even when Rola was talking about the trainings, you know, like even sometimes, you know, like because we've run this early bird training a lot, so you know, like even such trainings, we need to adapt to be culturally responsive. You know, like those trainings, for example, they involve like taking videos at homes, you know, like mothers interacting and fathers interacting with their children. So, you know, these things sometimes you need to adapt. Even things like, you know, like even as a school, we are very, very culturally aware of how even to, you know, like, you know, even like when we run something like, you know, like trainings and stuff like that, we even, you know, like we always ask the parents, do you want to have like a group of mothers and fathers, or would you prefer mothers only? So it's always, you know, even when talking about about their children, when, you know, like when we're having the celebrations in schools. So, you know, there's always this culture aspect that we have to take into consideration, talking about the children. You know, like and sometimes even when we're doing things like, for example, you know, like skills, for example, even like toilet training or things like that. No, we just, you know, like we're very aware that we don't, you know, like we don't take videos of children, you know, mastering such a skill or things like that. So of course, culture is always a very important aspect that we need to consider.
I just want to sorry, I just want to revisit one of the points that was made earlier. So about referral, because we had colleagues from Sidra Medicine who appeared earlier in the series, and they mentioned that they do take referrals from all institutions within Qatar. So if as a healthcare professional you identify a child with displaying symptoms or signs, then a referral can be made with the consent of the parents, and the referral will be considered by the Sidra team. Just to move on and to another question that we've received. So I think this is a very relevant question to some of our earlier conversations. So what challenges specifically exist in coordinating care between education and the healthcare system locally, and how do you think these can be overcome? Maybe Dr. Rola, you can answer this one. I think this was related to your topic earlier.
Yeah, you know, like regarding like the challenges, as we've said, like sometimes to reach to one of the like healthcare like professional that describes, for example, medicine to a child, it's not that easy. You said that the referrals, like they are acceptable. This is what we are doing also in our organization. That, for example, the psychologist, if she sees something that need a referral, we just send referrals to Sidra and Hamad Medical Corporations, and they are so like, you know, in help in that thing. But like regarding like the challenges, as I'm telling you, we feel that it's like it has to be a regular thing, you know. It's not only like when needed, when we have like regular like meetings like regarding like people that we are working with, we can discuss and review the things that they are doing and we are doing, because we feel that we need to be in, as I'm telling you, that we need to be on regular basis regarding the interventions that those children are receiving, either if it's educational or if it's something related to healthcare.
I think also it's very important here in Qatar to start not isolating the medical field away from the educational field. We still can, you know, like we still, as professionals, we can still sense this. But I think there has to be like, you know, like some more of collaboration between the educational professionals with the healthcare professionals. You know, like we have children who come with you know, like with prescribed medications, but we never know like what are the side effects of these medications. We know, like we go on and you just, you know, like it's out, you know, like we just do it because we care for these children. We just check like what are the side effects of these medicine. But sometimes even we don't know even that a child is on medicine. So I think it's very, very important now to just get those two together for the benefit of the child.
And Hiba, also bearing in mind that autism is different like than other disorders. Like when we say any other disorder or like disease, we know that healthcare, they may work on that by themselves sometimes, but like autism, because it's related to like the early intervention of like either applied behavior analysis or teachers or speech pathologists. So it's something that needs that kind of collaboration. It's not like a disease that, oh, you prescribe a medicine and you follow up as a healthcare like place. It has to be that collaboration with the education team in order to reach the fullest potential of that child and to be aware of the things that you've just mentioned, Hiba. Yes.
Exactly.
I just really want to insist on that point, because it's really, if you want to take something from that webinar, this is a really important note that we can take with us, because what we see often is that as schools, we have our multidisciplinary team together, and then we have the healthcare professionals. So the multidisciplinary team rarely, or let's say I've never like seen a doctor or a psychiatric in our teams, like hearing all our, like concerns, hearing like, how is that child? How is he improving? How is he now? Is he better or no? So having the healthcare provider with us in the team, meeting with us regularly is really important.
Yeah.
So because we often have those information from the parents who goes to the doctor, and then he will prescribe the medication, and then the parents will come. And then sometimes we, like as parents, they're not professionals. So sometimes the information that being shared by the professional, but by the doctor might reach, differently to us. So that's why it's very important that we hear it directly from them, and we can like share like our things together.
Honestly, I totally agree, and I think it's inspiring, the things you were talking about earlier about how this collaboration can lead even to a change of the perception within the community. So maybe can you give us any recommendations to schools, other schools within the country, and or healthcare systems about how to integrate the two sectors in a better way?
Okay, with schools, like we still, unfortunately, we still hear that, I worked in an inclusive school before, and, like it was very sad that still, like we could have like a special education department, but this department, they, like the professionals, they lack the understandings of the strategies of autism. Or how to deal with children with autism. So they end up having like shadow teachers who do the work for the child, and but there is no skills that the child is gaining. It's just like going as if it's just like a creche or a nurse, like something like like a daycare. It's just the child goes as if he's in a daycare, just they're ensuring that he's safe, but there are no skills being like taught. So we need like more professionals in schools to be very well educated in the area of autism. And it would be great also if the Ministry of Education would allow like really quality professional development for schools in this area, because it's a very, 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 like very individualized area. There are so many factors that are involved in autism education.
That's really true. I've been to school here since basically my whole life, and I've seen what you were talking about. Sometimes the teachers just do the whole work, like they write for the students rather than actually working with them.
Yes.
What about the other side of it for like healthcare systems and healthcare providers? What advice do you have for them from your experience intersecting both healthcare and education?
Consider the education in their like practice. I want to give you an example. Like I met a parent, and they told me that they took their child to the hospital without like mentioning the name of the hospital. And when the doctor, she saw him, she told them, and you can see easily and that he has like traits of autism, that child. But it's early to diagnose, and we always say don't seek for diagnosis when they are like 1 or 2. You start immediately with the intervention, because the earlier the intervention, the better outcome. So what she told them, he's fine. All what you need to expose him. Okay, exposure is the key, and we agree with her 100%. But you know that parents, okay, when you tell them exposure, what kind of exposure is that? Sometimes when they rely on like a therapy or a therapist or someone who's like working with them to tell them exactly, or to expose that child to the different like settings or different things that motivate or trigger the skills that he needs like to learn, or trigger like the motivation in order to gain that those skills, it will help them, and it will help the child at the end a lot. Her guidance and her recommendation is 100% true, but how to apply, how to implement it, it has to be in collaboration with like therapist or someone. As I said, it can be SLP, the roles that we've mentioned there that related to the education, approach. So we always say autism, healthcare with, it's not education. We don't say, when we say education, we don't mean that academics, it comes at the end. We say that, the team of like behavior analysts, the team of SLP, occupational therapists, psychologists, all need to work together with the, the healthcare system in order to gain the better outcomes.
I think one key takeaway from this session, and most of the session that we've done, really is the importance of collaboration between healthcare providers, the different healthcare providers, other sectors, and parents as well. And we've received many comments about how parents themselves, they need self-care, they need support. So what's your experience with that? What recommendations do you have about that? Perhaps about enhancing support services here in Qatar for parents or family members?
Shahid, like we've been like talking about this importance of educating and empowering parents is a key here. Like, they spend most of the time with their like children, more than like us as professions or like a healthcare like team. So empowering parents will help us as like, professionals to reach the targets and the objectives that we are willing to have with that child. How? By having like regular trainings, by having workshops, by, and it has to be done by both us as like education like organization and the healthcare, in order to enhance their knowledge and empower them as much as we can.
Shahd, there is also a very important thing, like what, like parents need to know like the rationale for educating themselves in this area. As Rola said, because they spend with them most of the time. So, like they need to know, like, like the very, very positive, they're just not going for a training that's burdening them, or, like it's just adding to their days, or, but they need to understand the rationale behind something like that. And we have seen parents, and like we've been in Renad for since it started, and we have like we have experienced parents who have been like very stigmatized, very shy, they didn't want to interact with us at all. But like with the right support, and with like even the way we speak to them, like because we've all
so the trust, I mean, when they trust us as like professionals.
Yes, exactly. Even the way that we deal with them, like we always encounter the 7 principles of effective partnership with parents. So like we can see how they moved from being this person to a very strong advocate for their children. Okay, what is my children? What are the goals of my child? So why didn't he do this? Okay, I want you to change this into this. So like these are the type of parents we need.
I think that's a very strong point that you've mentioned there, Dr. Hiba, in terms of understanding the rationale for such training. And I think we can probably extend that as well to beyond training sessions with parents, So say, for example, you've spoken about the importance of collaboration between different agencies in Qatar. There needs to be a strong reason why such training is being delivered.
Yeah.
So it's for the established, it's to raise awareness of existing referral pathways, to establish new mechanisms for referring patients and for closer collaboration. So I think that's a very, very strong point that you've made there. Well, thank you.
Thank you.
I think we've been very engrossed in our discussion. I just noticed that we went over time. Dr. Zakaria, perhaps.
I think we can take one more question here.
Okay.
I'm just trying to find one that's maybe relevant to a large number of. Okay. I think this is very, very relevant. I mean, we see this happening in healthcare systems across the world. And you mentioned about the blue circle, I think, Dr. Zaina. So I think where we see the establishment of sort of like expert patient groups that can act as advocates and act to support carers of persons with autism. So the question specifically is about how can we use those persons with lived experiences, either as carers or persons with symptoms themselves? How can we use those persons to advance our efforts here in Qatar?
Sorry, did you say with little experience?
No, their lived experience. So
yes. Because like parents, to be honest, they know more than the professionals. At some point, and after going from therapist to therapist, from doctor to doctor, they really turn into like experts in the field of autism.
Exactly.
Yes, and they are like the best people to advocate for their children. And because like sometimes if it doesn't touch you, you don't go through it, you don't push for it, because they are like they are like living into that situation day after day. They are really a very good advocate for their children. And starting like this initiative, it started like with few parents, but now if you can see on the ground, they are very active. Like now they are in the US with like with the US, like with the Qatar embassy in the US, and they are just there to also raise awareness, like what Qatar has done so far in the field of autism. So using those parents can really help in raising awareness in Qatar and help supporting their children.
Thank you. Dr. Rora or Dr. Hiba, would you like to also comment on this?
Yeah, you know what? Always when we say that we are focusing and highlighting the strengths and the positive experiences that they went through, and like sharing these experiences with other parents, this is also very important thing for other parents to hear, So because like if you're putting yourself like if you're having the same experience and you're going through the same thing that I am going and I am hearing from you, I would listen more. So having these trainings, workshops, including the parents in these trainings, and listening to them as much as possible and giving them the mic to share their experience, this can help a lot other parents to be also, confident to share. Because as I told you before, that at the beginning they may not be confident to share any kind of their experiences, but when they feel comfortable and they feel that there are other people that are going through the same thing, here we can start like seeing like other kind of people who are confident, who are willing to share, who are like more accepting,
Yeah, I totally agree. And actually that links very nicely to next week's webinar. So next week's webinar is all about the patient and family experience. So we're going to be elaborating a lot more on these discussions next week. But unfortunately, that's all we have time for today. I really can't thank you enough for sharing your insights, sharing your experiences with us, and thank you to giving up for giving up the time. And we look forward to welcoming you back to next week's discussion, and maybe you can contribute towards those discussions also. Dr. Shahid as well, thank you for moderating today's session, and thank you for all of the participants who've joined us and contributed towards sending your questions. Unfortunately, that's all we have time for today, and we look forward to welcome you back next week. Thank you once again. Thank you.
Thank you.
Thank you.
Thank you so much. Thank you.
It was really a pleasure. Thanks.